Start here. Good morning, one and all. This is Dr. Balaji Singh, Professor of Forensic Medicine, SCS Medical College, Chennai. Today's class is traumatic brain injury, that is subdural hematoma, subarachnoid hematoma, and intracranial hemorrhages and spinal injuries. It is railway spine. A great quotation on observing dead bodies. Topics already discussed. Today, subdural hematoma. Layers of the brain and skull indicating the subdural space. Blood collection in space beneath the dura. Huge collection of blood comparatively localized. Huge collection of blood over the hemisphere underneath the dura. Right side there is a subdural hematoma. Overall there is a subarachnoid hemorrhage. CT scan reporting subdural hematoma, banana shaped subdural hematoma. Subdural hematoma definition. By definition, bleeding occurring in a space between the dura and the arachnoid matter. It is essentially a venous or capillary bleeding, but arterial bleeding may possible. Most occasions, bleeding is light, but fatal compression of the brain by a large subdural hemorrhage can occur within few hours. Acute collection of 100 to 150 ml is minimum necessary for death. Subdural causes. What are the causes? They are the traumatic, spontaneous, surgical complications, or metabolic disorders, electrolyte imbalance, like hypernatremia, blood dyscrasias like hemophilia or purpurias. Extension from EDH, that is breach in dura, will cause subdural hemorrhage. Vascular abnormalities, AV, arteriovenous malformations, or perinatal childbirth injuries. Rupture of bridging veins, tears in dural venous sinuses, and tears in middle meningeal artery. Old adhesions between dura may get torn. Vigorous shaking, child abuse, shaken baby syndrome. These are the causes, just to go through it. Types: acute, subacute, and chronic. Basing on the time, within 3 days it is acute, within 21 days it is subacute, after 3 weeks it is chronic. Mechanism and source of bleeding is bridging veins. Bridging veins are connecting from cortical surface of the brain to the subdural space, subdural sinuses. A breach in bridging vein cause subdural hemorrhage. Clinical features: lucid interval may present even in subdural hematoma. Already we discussed what is lucid interval. It is a clear period between two bouts of unconsciousness. Initial unconsciousness is due to concussion. The lateral unconsciousness may be due to EDH or SDH. In SDH, the clear period may be prolonged because of venous origin of bleed. Enlarged pupil on the same side may be seen because of SDH, because of pressure effect on the third nerve. Blood tends to accumulate in the basal skull because of drain, free space. Whereas EDH, it is a potential space. There is no space actually between skull and dura. But whereas a space between arachnoid and dura, there is a space. That's why the bleed can tend to spread over the brain.